अस्सलाम वालेकुम इयाका नअब्दु व इयाका नस्तईन। तो आज की इस वीडियो में SK17 का मेडिसन 21 नवंबर आफ्टरनून का मैं पेपर करने जा रहा हूँ। तो लेट्स स्टार्ट। क्वेश्चन नंबर 1, द पेशेंट हैड द ट्रॉमेटिक इंसिडेंट ऑफ अपर लिम्ब फॉर 3 months. He feels pain and the tenderness or swelling develop at the region on the X-ray. Swelling is bright after 1 year. It resolved. Phenomena is metaplasia. Question number 2, the follicular carcinoma of thyroid mets to which organ, that is lungs. The question number 3, the lesion at the left optic tract results in the right homonymous heminopia. Question number 4, the patient with the enlarged hand and the feet with associated joint on MRI mass compressing optic chiasma was found that can occur in this patient, that is the bitemporal heminopia. Question number 5, the left temporal gyrus lobe lesion results in the right superior quadrantanopia. Next question number 6, the 45-year-old previously normal lady started having dyspnea, dry cough, fever 3 months back, recovered for 1 month when she went on the vacation. Again developed the symptoms when she got back to her Canaries. X-ray multiple nodular lesions in all lung zones. The mechanism of her symptoms was due to the antigen antibody mediated reaction, that is hypersensitivity pneumonitis. Question number 7, the pregnant woman with an increase in the abdominal girth is due to the normal response to physiological stimuli. Question number 8, a newly married female came with the right iliac fossa pain. Her TLC was 12,000. She has a fever, vomiting, LMP was 3 weeks back. Likely diagnosis is appendicitis. 9, the woman is suffering from HIV. What cancer she is at the risk of developing, that is the uterine and the cervical carcinoma. Question number 10, extreme left shift of hemoglobin oxygen curve if due to which of the following, that is the carbon monoxide poisoning. Question number 11, the decreased gastric secretions is by the secretin. Question number 12, in the normal persons decreased acid secretion causes the abnormal protein digestion. Question number 13, the patient with the hypertension into the labs investigation VMA found in the urine is due to the phychromocytoma. Question number 14, the posterior branch at the aortic bifurcation is which of the following, that is the median sacral artery. 15, mechanism of action of NSAID is inhibit the arachidonic acid. Next question number 16, the maximum water absorption is at the PCT 17. A 56-year-old executive officer after eating burger with the fries gets his lipid profile done. After centrifuge his plasma appears milky white. This is due to chylomicrons. Next 18, infection the kidney pus up to Gyrota fascia with the fascia intact. It can spread to the inferior to the pelvis. 19, the glutamate aminotransferase and alanine aminotransferase formation use which vitamin, that is the biotin. 20, the woman with the breast cancer subsequently developed metastasis to the vertebral column. The most direct route of spread of the tumor to the vertebral column with the venous connections. 21, the increased calcium level is due to the increased PTH. 22, the patient has the respiratory depression due to the involvement of opioids act on which receptor, that is a strong mu receptors agonist. Patient after penetrating abdominal injury on the antibiotics for the 12 weeks therapy and the 3-week TPN with the ecchymosis platelet normal PT is 14. The cause is the vitamin K deficiency. For 24, the man after RTA got a head injury which is to be stitched. 10-inch wound laceration with anesthetic agent will best be for the suturing the wound, that is the 250 ml of 2% lignocaine with the adrenaline. 25, the event occurred just before opening of the aortic wall is the beginning of the systole. 26, which one of the following occur in the inflammation, that is the exudate. Next question number 27, the follicular carcinoma of thyroid mets to which organ, the lungs. The patient presented the fever, next TTT, Kernick's and positive, which investigation should be carried out. CSF analysis, only indication of the use of the radionuclear scan. The patient with the developed and diagnosed thyroid carcinoma would be to see cancer mets in the spread. The woman with iodine deficiency cause would be the poor dietary status. The apoptosis is characterized by the no host inflammation with drug safe in the liver decompensation disease, that is the oxazepam. 33, which of the following narcotic when given epidural cause the delayed respiratory depression, that is gonna be the morphine. The serology test for the aspergillus is the galactoman. 35, the posterior and anterior humeral artery are the branches of the axillary artery. 36, the patient having vesicles in the lateral forehead, the medial side of the eye and the left nose with the severe facial pain and headache. Which nerve is involved, that is the maxillary nerve, trigeminal nerve. 37, the patient undergoing thyroidectomy developed the harshness of eyes. Nerve involved in the vicinity of inferior thyroid artery ligation is the regional laryngeal nerve. 38. The patient undergoing thyroidectomy developed Hodgkin's of eyes, nerve injury in the vicinity of inferior thyroid artery ligation in the recurrent range of 39. The young man sustained RTA with the multiple rib fracture, has the difficulty in the breathing. You notice that he is moving more during the breathing. Which muscle help him in the breathing? That is external oblique. Hand, foot and the mouth disease causing virus would be the non-enveloped RNA virus, which is the Coxsackie virus. 41. The intercostal nerves are from the dorsal rami of the spinal nerves. 42. The nerve passing through the petrous part of the temporal bone is the fascial nerve. The volume of amniotic fluid, as the term is the 800 ml. The structure prone to damage in the quadrangular space is the branch of the axillary nerve. 45. The cubital fossa, most medial structure would be the median nerve. What are the small veins that commonly accompany arteries and play a role in a venous return? These are called the vena comitans. The tailor had the TB infection transmitted to two of his family members. Mode of spread of this would be the aerosolized air droplets. Next, 48. The patient present with the breathlessness. PA 7.35, partial pressure of carbon dioxide 60, oxygen 75, bicarbonate 18. Which acid-based disorder is this? That is respiratory acidosis. 60-year-old patient. Which medical condition is likely to be present with the decreased reticulocyte count due to the impaired erythropoiesis? That is the chronic renal failure. The 50. The pain of the indirect inguinal hernia is due to the compression of which nerve in the inguinal canal? That is beta, which is the ilioinguinal nerve. Next, the PCT absorb 45 to 50%. Which of the following? That is the urea. 52. Embryonic mesoderm is formed by the epiblast. 53. Sickle cell anemia. Child has the painful abdomen in the legs and the low HB. Which hemoglobin will be seen in his blood? That is the HbS. 54. The which blood vessel primarily supplies the proximal portion of the common bile duct? That is Charlie hepatic artery. The patient presents the decreased peripheral pulsation with the abdominal pain and the creatinine kinase normal in the pulsating abdominal mass with fasting glucose of 130 to 150 for last 20 years. Is most likely suffering from the abdominal aortic aneurysms. 56. A known CLD patient presents with the hematemesis resulting from the rupture of the esophageal varices bleeding from which vessel? That is the left gastric vein. 57. Which structure is notably absent in the cervical spinal cord when compared to the thoracic and the lumbar spinal cord? That is the lateral horn. Which muscle result in the vocal cord abducted position? That is steatoretinite. 12-year-old child presented with the hepatosplenomegaly. Blood count showed the decrease TLC count and decreased platelets. Which of the following investigation should be done? That is the blood culture. Next, 60. The fifth metacarpal fracture would be beta, which is the boxer's fracture. Next, the 61. The prolactin induced hyperprolactinoma occur due to the decreased dopamine from the hypothalamus. 62. 55-year-old male developed the gastric lymphoma. He gives history of epigastric pain of the several years duration for which he was treated many times. Most likely cause would be the H. pylori gastritis. 63. The artery which can be palpated in the mandible near the angle of the jaw is the facial. Hypothyroidism clinical signs are due to which of the following? That is the beta increase lipolysis. 65. The chlorothiazide most common side effect would be hyperuricemia. 66. The contents of umbilical cord at the birth of the two umbilical arteries. In hanging, sudden death occurs due to the fracture of odontite process of axes. The adult genital lesion under the microscope shows the squamous papilloma. Causative agent would be the HPV. 69. The pass pointing test due to the done to see the lesion is which of the in which of the following? That is the cerebellum. The Parkinson patient taking the levodopa side effect would be Charlie orthostatic hypotension. 71. Anesthesia contraindicating 70% burn is the suxamethonium. 72. This is the health lengthy scenario. Basically, after a RTA patient has presented with the focal a physician proceeds with the focal neurological examination testing the child reflexes of the following nerves would carry the efferent impulses of the cremasteric reflex. The answer would be the genital branch of genitofemoral nerve. Next, 73. The spinal cord compression is due to the osteophytes. 74. The posterior interosseous nerve supply which muscle? That is the anconeus. Next, the smoker who is having 2 packs per day with the associated heart disease is at the risk of which arterial complications? That is going to be the atherosclerosis. 76. The most common intracranial tumor is the astrocytoma. 60-year-old man is in the OPD with the complaint of hematuria and the increased urine frequency. DRE, there is a stony hard mass felt that the prostate lymphatic drainage of it would be the internal iliac and external iliac. The left shift of the oxygen dissociation curve is caused by the hypothermia. Extreme left shift of the hemoglobin oxygen curve is due to which of the following? There is carbon monoxide poisoning. The student has the viva exam. Which waves are seen on the EEG? The beta waves. The EEG of the patient shown the A wave because the patient is alert and the conscious. Next, 82, the antiseptic used for the skin wash would be the alcoholic chlorhexidine. Abdominal and the gynecological surgery, which of the following organism causing infection, which are the penicillin resistant? The beta lactamase production, that is the bacteriides. Patient having the proteinuria, the hematuria cause the generalized body swelling with the decreased plasma oncotic pressure. The M band in the multiple myeloma are produced by which cells? That is the plasma cells. The patient has the CVA, now has a zero power in the muscles. Which of the following sensory receptors are not functioning in this patient? That is the nociceptors. The NK cells cause which of the following? There is the destroy the virus infected cells. The COPD patient will be made by diagnosis will be made by the there's a VQ ratio equals to 0.1. ICF as compared to ECF has increased glucose. Excessive meningeal artery passes through the foramen ovale. The most common cause of bacterial conjunctivitis is the Staph aureus. The patient has the lower limb paralysis and unable to recognize the objects due to the damage of beta, which is ACA. The next 93, the lateral part of the foot damage in the drill exercise of formic acid in the PMA. The lymphatic drainage of it would be the popliteal. The sesamoid bone is the patella. The boy continually failing in the exam. He is doing anger to his parents. This type of the defense response is basically the displacement. Large tumor in the posterior mediastinum will compress the descending thoracic aorta, which is the inheritance pattern of hemophilia A, that is the X-linked recessive. A lady working in the radiation zone, which is the following system affected first by the radiation? That is the hematopoietic system, which when used in the venesection in the great saphenous vein is basically used 100. Most common the pancreatic carcinoma would be the adenoma 101. The patient has the weakness in the flexion, supination, sensory loss on the lateral side. Which of the following nerve injury is responsible for it? That is the musculocutaneous nerve. The gram active bacteria such as the Shigella have the endotoxin in their outer membrane of the cell wall. The 103, the deep palmar plantar artery is the branch of the dorsalis petus. The fetal part of the placenta is delta. The disease of bacillus in the colon frondosum. 105, the eating raw or undercooked meat can cause the infection by the tapeworm. 55 years old man with the painless testicular swelling and LDH raise. What is the diagnosis? That is the lymphoma. 107, the posterior cerebral artery when damage causes homonymous heminopia with the maculosporing. 108, the kid with the sweat chloride test positive developing recurrent chest infection otitis media. The likely association would be the bronchiectasis. The injury to the greater wing of the saphenite and the inferior orbital field damages the zygomatic nerve. Next, 110, the in pneumothorax, lungs inward and chest wall outward. 111, the after 6 months of the renal transplant, the patient presents the sign of the renal failure. His symptoms are resolved by the giving immunosuppressive therapy. What is the likely cause? That is the acute cellular rejection. 112, the 50-year-old hypertensive patient presented with the severe pain radiating towards the back, suddenly collapse on autopsy. What could be done? That is the could be seen, that is the medial necrosis. 113, the fastest speed of the conduction velocity is present which of the following? That is the Purkinje fibers. Next, 114, between stomach body and the pylorus, what is present? That is the Charlie, which is antrum. Which of the following hernia is associated with the herniation through the Hazelberg triangle? That is the directing one hernia. The fertility lean at the head of the sperm helps in the adherence of the sperm head to the ovum membrane. Next, 117, the part of the sperm containing proteolytic enzyme to digest the zona pellucida is the delta, the acrosome. The structure from the medial to the lateral in the femoral triangle would be the vein, that is the vein, artery and the nerve. Next, the artery layer from the inner to the outside would be the tunica intima, media adventitia, CRP, transferrin and the haptoglobin are the examples of the acute phase reactants. Sodium channel inactivation occurs in the absolute refractory period. Both sides, lateral pterygoid and the anterior belly of the gastric contract or pull leading to opening of the mouth. Excess normal saline infused, this will lead to the increased blood volume. 1 to 4, the insulin dependent GLUT4, the transport of glucose across the cell membrane occurs by the facilitated diffusion. 1 to 6, as a resident in the pediatrics, you are called to see a newborn who has the unilateral cleft lip and unilateral cleft of the primary palate. This condition is most likely due to the failure of the fusion of the maxillary prominence with the medial nasal prominence. That's the cause of kidney stone. The vitamin A deficiency is atrophy of the renal mucosa. 55 years old male having the scrotal mass in the raised LDH. Probable diagnosis would be the testicular lymphoma. Thumb flexion is caused by the deep branch of the ulnar nerve, which one passes above the transverse carpal ligament, that is the ulnar nerve. If you palpate midway between the ischial tuberosity and the greater trochanter, it will be right above the superior gluteal nerve. Next, 132, the ectopic thyroid hormone is released by the carcinoma of the bronchus. The 30-year-old male presented with the history of the fever, significant weight loss, painful maturation, maturity of flank mass is HB is 18, which could be the possible pathology associated with the condition, that is going to be the RCC. Next, which organ comes from the two parts, from the dorsal and the ventral primordium, that is the pancreas. Student examining staining which shows gram positive cocci in the chain. Many attempts made but cannot be cultured. What other technique can be used to apart from it? That is the serology. Patient after gastrectomy develops the pernicious anemia due to the loss of the alpha cells, which are the parietal cells. Next, 138, the normal and diastolic volume is 120 ml. 30-year-old female present the OPD, the excess hair, growth, hypertension, hyperglycemia, hyperpigmentation, increased depression, edematous face, increased fat on the chest, trunk. It is likely due to the excess of the ACTH. The patient of the tonsillitis with the cryptal abscesses organism would be the step pneumonia. For the formation of the sacral angle, which vertebra is involved, that is L5. The follicular lymphoma gene involved would be the BCL2. Low grade follicular lymphoma translocation, which of these? There is a translocation of the 14:18. Which one is the sesamoid bone? That is the patella. The middle-aged woman with the pain in the temporal region and the pulsation felt in the temporal region, now having the visual disturbances. Cause would be the giant cell arteritis. The inferior rectal artery is the branch of the internal pudendal artery. Injury to the greater wing of saphenite in the inferior orbital sphere damages which nerve? That is the Charlie. The zygomatic hyoid bone is derived from which pharyngeal arch? That is the second and third. Which drug is used in the headache and contraindicate the peripheral vascular disease? That is the igomatrin. The female with the severe abdominal pain diagnosed as an acute biliary colic, giving morphine as an analgesic. Which additional drug beside morphine will provide good analgesic relief? That is the hyoscine butyl bromide. 151, the patient after eating from the restaurant in a dinner, then at the midnight present the diarrhea. This is the staph aureus. The aortic arch aneurysm compressing which nerve cause the harshness of voice? That is the recurrent. Which structure arches over the root of the right lung? That is the azygous veins. The male present the operative the 104 for the last 4 days and gives history of using antimalarials. He has been passing cola colored urine for the last 1 day with the D range LFTs and increased unconjugated bilirubin. That is the G6PD deficiency. The patient has the cirrhosis in the histology. Malary body is present. What is likely cause? There is alcoholic hepatitis. Woman and the man have the history of recurrent pregnancy. Their clinical and genetic history is unremarkable, but all pregnancies end up stillbirth. The investigation would be the karyotyping. Next, 157, the gram-negative bacteria such as the Shigella have the endotoxin in the outer membrane of the cell, while the glucose enters the skeletal muscle via the GLUT4. The selective proteinuria is seen in the minimal chain disease. Bleeding from the kidney contained within the gyrus fascia will go where? That is the inferiorly into the pelvis. Next, last, the thoracic duct block causes the chylopericardium. So thanks for watching my video. Do subscribe my channel. Until my next video, Allah Hafiz.